Hey dear soul, and welcome to this video. Veterans in the United States face higher risk for substance misuse than many civilian populations, not because of weakness, but because of exposure. Combat trauma, post-traumatic stress disorder, PTSD, chronic pain from service injuries, sleep disruption, moral injury, loss of mission, difficult transition into civilian life. Substances often enter the picture not as rebellion, but as regulation. This is about understanding what's happening and how to heal it. What veterans commonly use and why. Healing starts with clarity. First off, alcohol, the most common. Alcohol is the most frequently misused substance among U.S. veterans. Why? It's legal, accessible, it numbs hyperarousal, it damages intrusive memories. It temporarily reduces anxiety. It helps inflate sleep. But physiologically, it worsens REM sleep, increases depression, increases PTSD symptoms, intensifies. It fuels binge cycles and shame. In treatment settings, alcohol is overwhelmingly reported as a primary substance of concern. The focus of healing is that alcohol misuse is often trauma regulation failure, not character failure. Next is opioids. Veterans experience higher risks of chronic pain due to service-related injuries. Prescription opioids like oxycodone and hydrocodone are often introduced legitimately. The risk emerges when tolerance develops. Doses escalate, psychological reliance forms. Illicit opioids include heroin enter the picture. Overdose rates among veterans have reflected this risk. The healing focus is pain must be treated, but comprehensively. Integrated pain management includes physical therapy, non-opioid medications, trauma therapy, somatic regulation, interdisciplinary pain clinics. Opioid misuse is frequently an intersection of physical injury and psychological distress. Marijuana and cannabis use, self-medication. Cannabis use among veterans often reflect attempts to manage PTSD symptoms, chronic pain, insomnia, and anxiety. In states where it's legal, access increases use. While some veterans report symptoms relief, cannabis can maintain avoidance of trauma processing, reduce motivation, worsen mood instability in some individuals. Healing. In healing, if cannabis is serving a function, therapy must replace that function, not just remove the substance. Other illicit substances. Though less prevalent than alcohol or opioids, veterans also report heroin, cocaine, methamphetamine, and stimulants. These often correlate with severe trauma histories. Polysubstance dependence, high impulsivity states, untreated PTSD or depression. The healing focus. The substance is rarely the root cause. It is an attempted solution to unresolved dysregulation. Prescription sedatives, benzodiazepines, prescribed for anxiety or sleep may be misused. Risk includes dependency, withdrawal, complications, dangerous interaction with alcohol or opioids. Healing focus. Long-term healing requires nervous system retraining, not sedation alone. The core truth. Substance misuse in veterans is often trauma-driven, pain-driven, identity-driven, isolation-driven. If we only treat the substance, relapse remains high. Relapse risk remains high. If we treat trauma, identity loss, pain, and isolation, outcomes improve significantly. Evidence-based healing framework. Motivational interviewing. Resolve ambivalence. Explore what is the substance doing for you? What is it costing you? What kind of life do you want long term? MI builds internal motivation, critical for veterans who value autonomy. Cognitive behavior therapy, or CBT, for substance use disorders. Identify trigger, then thought, then emotion, the urge, use, consonant, replace catastrophic thinking, I can't handle this sober, hopeless narratives, with regulation skills, urge surfacing, behavioral activation, structured relapse prevention plan. You cannot handle and heal addiction without addressing trauma. Options include prolonged exposure therapy, cognitive processing therapy, EMDR, somatic trauma therapy. When trauma symptoms decrease, substance craving often decrease naturally. 12-step or peer recovery models. Veterans often miss peoplehood, structure, shared accountability, mission focus. Peer-based recovery provides community, humility, purpose, service orientation. Service to others is neurologically protective against relapse. Integrated pain plus mental health treatment. For opioid-related recovery, medication-assisted treatment, MAT, when appropriate, multimodal pain management, physical rehabilitation, psychological pain coping strategies. Pain is real. It requires real treatment, not more judgment. Rebuilding identity. One of the deepest drivers of substance use in veterans is identity collapse. Military identity. Clear role, clear rank, clear mission. Civilian life, ambiguous, unstructured, disconnected. Healing includes defining a new mission, rebuilding community, restoring agency, creating meaning beyond service. Substance recovery is not just abstinence, it is reconstruction. Practical first steps, medical evaluation, especially for alcohol or opioid withdrawal risk, full trauma screening, pain assessment, integrated treatment plan, not siloed care, peer support connection, structured daily routine, crisis plan for binge episodes. Closing message. Veterans are at elevated risk for substance misuse, not because they are broken, but because they carry burdens most people never will. Substances were coping tools. Now it's time to build better ones. Recovery is not a loss of identity. It is a redeployment into civilian life, with strength redirected, not erased. You were trained to adapt under extreme conditions. Healing is another adaptation, and it is absolutely possible.